And welcome back to the Factor Uncensored. Monkeypox cases are still popping up around the country and right here in the Houston area. Fort Bend County has confirmed its first monkeypox case. Infections can be passed to anyone of any gender from a bit of hanky-panky, bodily contact, fluids. You know the deal. But for some reason, the disease has become attached to the gay community. My next guest tells me it's an inaccurate and unfair stigma. And joining us now here on the Factor Uncensored is Mike Webb, an LGBTQ activist here in the community. So, Mike, how did monkeypox all of a sudden become a gay person's disease? We're hearing that, we're reading that in reports. How does this hurt your community when anyone out there with person-to-person contact can get monkeypox now?
Yeah, there's obviously a stigma, right, when it comes to new emerging public health issues, but especially when it comes to close contact activity, transmission activity. And unfortunately, when you're seeing these attacks on LGBTQ plus communities as it relates to monkeypox, you're seeing a repeat of history of sorts of when the LGBTQ plus community was also blamed for the start of the HIV/AIDS epidemic, and also other sorts of public health issues. And that's just absolutely not the case, as you said before. Monkeypox is a legitimate public health issue, but it's also relevant to all people. The monkeypox, our public health response to monkeypox should not promote homophobia or racism, quite frankly.
And do you think that's part of the problem, their response to it, when they say, when they announce who has tested positive and it just happens to be a gay person, they'll say, well, you know, and that stigma is attached.
Yeah. Yeah, well, you know, it's easy to demonize a group of people who you may not immediately understand or believe is in your close network. But the facts are that, as you said earlier, monkeypox can be transmitted from skin-to-skin close contact. And as the CDC reports, that can even mean in a crowded concert, a bar, or a club, or any type of body-to-body with other people, close contact. And as you can hear from those, you know, transmission abilities, that could be applicable to any one of us. And so not only is it homophobic to immediately attach this to just the LGBTQ plus community, but it's also a public health threat because it lets people think that anyone who's not part of the LGBTQ plus community is not susceptible to monkeypox, and that's not the case.
They would say, look, I'm safe, that doesn't affect me. Now, this supposedly started in raves in Europe, and obviously it's been spreading to the rest of the world, even here in the United States and in Texas and Houston as well. For individuals who may find a stigma attached to this, do you think this would prevent them from going to get a test to determine if they have it, because they don't want to be associated with it because it's now associated with a particular group?
Absolutely, and that goes back to what we were saying about how this is a public health threat by immediately attaching this to the LGBTQ plus community. Because now people who may be experiencing symptoms of monkeypox are going to be less likely to engage in healthcare that they need, not only to provide treatment, because this is a treatable disease, this is a treatable virus. There has been 0 deaths so far. But also it enhances the possibility of them transmitting monkeypox to other people.
Is there any movement or any action that the LGBTQ plus community will take to make the public aware that this is just not some gay disease, but this affects everyone?
What we try our best to do is encourage all healthcare professionals and anyone that is doing like yourself, and thank you so much, Isaiah, for allowing us to have this opportunity, to refrain from stigmatizing language around communicating about monkeypox, and to just stick to the facts, because when you stick to the facts, you can see that monkeypox can be transmitted by anyone, and anyone can unknowingly transmit the virus to other people as well.
All right, Mike Webb, always good to see you, and thank you for joining us tonight here on the Factor Uncensored.